Good afternoon. My name is Efernstro. I'm a student at Aspen University. This short video presentation is prepared for our module on activity-based teaching and simulation. There are a few different elements to this presentation. First, I will discuss the use of mental imaging when teaching motor skills. Next, I'll share interprofessional case scenario that can be used in an undergraduate program and the elements to consider when creating this case study. The third topic for discussion is describing a clinical situation that can be translated into a simulation, as well as how that looks and what will be learned. Next, I have drafted a scenario that has an element of end of life and patient autonomy, both topics that often have an ethical component. Lastly, I've created a word search puzzle to review the instructional methods and other concepts discussed in this module. So let's get started with mental imagery. Using mental imagery when learning motor skills can be very effective. There are reports of professional athletes using mental imagery to improve a skill related to athletic performance. The same process can be helpful in teaching a new motor skill or relearning an old one to a patient who has deficits with mobility, for example. From personal experience in helping a patient to learn to walk with appropriate mechanics after a few years of not, mental imagery could have been very helpful. After walking with this limp and leg swinging for many months, it was a struggle for this patient to get the mechanics mastered at walking appropriately with a heel-toe motion. With a few slow, deliberate steps, the patient could follow the correct mechanics, but without thinking about each individual movement in taking a step, it was easy for the patient to slip back into limping and not even realize it. Facilitating this patient to close their eyes and see themselves walking with exact precision and ease could have likely helped to change the mind's muscle memory in a shorter period of time and with less struggle. Our next talk is about clinical practice, how we are always in communication with other disciplinary teams. Learning these skills is invaluable. The scenario I've drafted to encourage interdisciplinary communication is about a patient refusing care, specifically a dressing change. The patient is a 60-year-old male who was hospitalized with a foot infection encompassing the entire ball of his foot. Due to neuropathy, he was experiencing no pain from this wound. The patient's medical history includes uncontrolled diabetes, end-stage kidney disease, and he has been on outpatient hemodialysis for the past 6 months. Upon admission, he was taken to the OR for a wound debridement. At about 10 a.m. on post-op day 2, he spiked a fever and the dressing was soaked with yellow and pink fluid. There was a physician order for a dressing change, and the nurse also needed to assess the wound. The primary RN entered the room to change the dressing and assess the wound. The patient refused to allow the RN to touch him. Referring to the multiple steps in creating a scenario found in Bradshaw, first is to identify the who, what, when, and how of the multidisciplinary scenario. In answer to the who, this scenario is geared to, it is the primary bed nurse, the wound care nurse, as well as the resident and attending physician. The what are concepts being taught in the scenario. Those concepts include appropriate patient care, escalation process, patient education, and of course documentation. The why is because it is a rather common situation. Refusal of care can and does happen with many patients. The next step is to go into the field, meaning to have the scenario based on a real clinical case, which this definitely is. The supplementary data would include medical history and the change in patient status, i.e. spiking a fever. The remaining 3 steps include double-checking the scenario by seeking feedback from another healthcare professional, and as the scenario is integrated and used in an education program, to continue and evaluate the effectiveness of the scenario in teaching the concepts intending to be taught. Lastly, we're encouraged to revise, revisit, and refine on a regular basis. Teaching is fluid, and as educators, we should always be willing to listen to feedback and be making improvements to our curriculum. Next, let's move into a clinical situation that being used as a simulation exercise, as well as what type of simulation would be utilized and what psychomotor and cognitive skills would be hoped to achieve. Lastly, what is the role of the educator and what are the important elements of the debrief session? The scenario pertains to a 63-year-old male patient with a history of gunshot wound 10 years prior, resulting in paraplegia. The patient was admitted with shortness of breath and fever, which had been getting worse over the past 5 days. His chest x-ray showed pleural effusion and a suspected mass. The patient was taken from the ED for a CT scan. While in the CT scanner, the RN accompanying the patient noticed that the patient's oxygenation began to decline. He arrived on the floor on 4 liters of oxygen. His saturation was at 98%. The RN noticed that they are declining quickly and went down to 92%, 87%, and then to 62%. On one of the students could play the part of the patient, making this a patient simulation. Other roles to be assigned could be the radiology tech, who is running the CT equipment, the bedside nurse who accompanied the patient to the CT scan, and the physician and respiratory therapist who would arrive if a rapid response was called. As an educator, my role would be to ask questions, guide the team to use critical thinking, and to learn the proper interventions. And then after the simulation, it is imperative that a debrief be held. It is important for the students to reflect on their experience and share how they are feeling about the actions they took and the connections to their clinical experience, or even connections to their clinical inexperience. Importantly, the facilitator should create an environment for the debrief that is safe for all to share and feel supported. Next, let's move on to ethics. The scenario that I will describe is about end of life and patient autonomy. These are often tough situations for a nurse, family, and physicians. The scenario I drafted involves a patient with stage 4 pancreatic cancer who has been through many months of chemo and radiation therapies. He expressed to the RN late in the afternoon that he is tired of fighting and does not want to continue treatment. The patient then declined throughout the night. The next morning, the same nurse returned to care for the patient, and the patient's wife was already at the bedside. The oncologist came to see the patient and discussed with the wife a new experimental treatment that was available if she wanted to try this option. The wife, not wanting to give up, said, "Yes, please, we must try." Since the patient was now obtunded and not communicating, the wife would be the one to sign the consent. Seeing the desperation of the wife, the RN wondered if she should share her conversation with the patient or keep it to herself. After all, if the treatment worked, wouldn't the patient be glad? Nurses, especially those in critical care areas, can benefit from discussing these types of scenarios and to really evaluate their own personal feelings and biases before they are put into this type of situation that calls into question a patient's autonomy. And lastly, I wanted to share a word search that I created to help review the instructional methods and terms found in our readings and assignment. Here's just a picture of the word search. The words are not listed. I've listed definitions of the words that need to be created, and then I have actually a number of bonus words. So I will include a copy of this with my assignment paper that links my YouTube video. Thank you very much.